Welcome to the Stories of Lockdown, a podcast series by India Spend and Nicor Associates. Here we seek to shed light on women's narratives during COVID 19. The pandemic has disproportionately affected women, deepening pre existing gender divides and setting back gender equality. While each episode will have a different sub theme, the broader focus will remain on women and their lives under the lockdown. For today's episode, I, Priyal Mundra, will be your host. I am joined by Miss Malathi from Aknale. Hi Malathi, how are you?
Hi, Priyal. I'm fine, thank you. Happy to be here.
Amazing. Why don't you share a little bit about yourself and Aknale and how has it been affected during the pandemic?
Happy to do that. I am Malti. I work with Aknale as the Director for Education and Livelihoods. I have about a decade of experience in the corporate and non-profit sector. I am really passionate about issues of gender and caste, participatory development, and human rights. So that's just a brief introduction about myself. I can go on to now talk about Aknale. Aknale is an NGO in Mumbai working with the urban poor. The mission of Aknale is to enable access to basic services, healthcare, education, and livelihoods, and empower the urban poor to help themselves. Also, look at the provisioning of civic entitlements through advocacy with the government. It's been established in 1973, and we have been working with the urban poor settlements across Mumbai. And currently, we are focused our work in M East Ward, the ward which has the lowest Human Development Index in Mumbai. We also, in this year, have been able to expand to two different geographies in Gujarat and Jharkhand. So this is just a brief, and our key focus, one of the key focus areas that we have is the Community Childcare Center, which is an enterprise-based model where urban poor women are able to access affordable childcare services, which enable them to seek employment opportunities. If I have to speak about the COVID pandemic, overall it has had a very adverse impact on the communities that we work with. The community where the average household income is around rupees 13,550, which comes to around 2,500 per month per individual. Here it was reported that 46.7% of the respondents received no income during the lockdown period. And it was in this context that within 24 hours into the lockdown, we dived into relief provisioning for the community. We also ensured that we were in touch with the community volunteers and our stakeholders so that we are able to respond to the various needs and challenges that began to arise during the lockdown.
Right. So like you've highlighted your community childcare centers, can we know a little bit more about that and how has it exactly helped women's economic participation and what's happened to it during COVID?
Sure. Basically, the genesis of this idea came from our understanding that there is a lack of safe and affordable childcare in the community. There were many reported cases where children were locked in their homes and sometimes even chained with little food and water when both parents had to go out to earn a livelihood. Basically, we came to find out that there was no safe place where the parents were comfortable leaving their children, because between the age of 6 months to 6 years, there is no provision for that in urban poor settlements. So in the beginning, we started with running a creche of our own. But we also realized that the needs in the community is much more, and we need to think of a sustainable model which can help serve this requirement. That's where the Community Childcare Center idea came up, which is basically an enterprise-based model where we train women to become entrepreneurs who can provide home-based childcare services at an affordable rate in the community. During the initial few months of the pandemic and the lockdown, we had to shut down the CCCs because there was a considerable risk to the children. There was still not much understanding about the disease itself. And the lockdown also meant that most of the mothers lost their jobs and they had to stay at home. So this also affected their income, and which impacted the CCCs as well. So during the initial month, we had to close all of our centers. And I can just share some of the important findings we got regarding the impact of COVID on the women running CCCs.
Love to hear that.
Yeah. So the women running CCCs, they in their household, 1% in 75% of the households lost their job or source of livelihood. 53% of households had to take some sort of loan during this time. After the lockdown, in fact, only 36% were able to start working. And also the average income of the CCCs came down from 2,754 to 2,028 after the lockdown also. Because even after the lockdown, it took some time for women to get back into employment, right? So that's factor. But the silver lining here is that from August 2020, we started really working on the revival of these CCCs. And we realized that we will also have to support the mothers to get back into employment. So right now, we have actually increased the total number of CCCs. We have around 50 community childcare centers run by 100 women, which support 261 children and enable 182 women to seek livelihood opportunities.
Right.
Yeah.
I think that's great. I mean, slowly things have been opening up since last year, and women are trying to get back into employment. But what I'm also interested in to know is, I'm assuming during the second wave, it must have gone down again. So has it started recovering now, post the second wave?
Definitely. In general, the communities that we work with, and I think this is common for most urban poor settlements, in general, it is difficult for women to get into economic activities, and I would say skilled economic activities, because there are a lot of barriers which come in place because of that. And as I said, only 36% were able to start working full time after the lockdown.
Yes.
So of the number that lost their livelihood. So it has been an uphill task, and that's where what we have tried to do is link them up with local opportunities, that is in the settlement itself. If there are some local industries where they could go to and try out working there, because most of them are unskilled. As we know, in the community that we work, around 37% of the women have no or less than 5 years of education. So in general, it is very difficult for them, and all of them would be mostly in informal economy or unsecure jobs where it's not a permanent employment. So they also don't have the social security benefits. Therefore, it has been difficult, but we have been able to link them up to local opportunities. And this time round, one of the good things was that there was some transport possibilities, so they could still travel to nearby locations. So that also helped in the process.
Right. So you've mentioned the hindrances that women face in for participation in economic activities. Are there any other hindrances apart from the availability of employment that you've noticed the women in the communities that you work in face?
So as I said, one is definitely the whole aspect of lack of education, higher education. There are very less proportion of women who have higher education. So the kind of jobs that they normally get is in the informal sector, like they would be domestic workers, or they would be working as a contract worker for piecemeal rates. So these are the kind of employment that they get. And I think one more reason is that the responsibility of household work and caregiving primarily falls on the women. And especially during the lockdown, when men have also lost their jobs and they are finding it even more difficult in some cases, because the moment the lockdown ends, the women do get back to the household work or the domestic work or employment that they had, but men find it more difficult. So then the time required to do all of that and then go for employment becomes very difficult. The proportion of women in employment in our community is only 9.7%. And 89% of these women stated that they are not looking for any employment opportunities because they have enough unpaid household work. So it will be only in very dire circumstances, that in distress, I would say, that they would seek employment, which is not always secure employment and brings its own risks with it. Second is the lack of supportive ecosystem that is there in terms of basically the rigid gender roles in terms of what kind of work a woman can do. It's okay if she can sit at home and work. So if you look at our study also, there are mostly tailoring job is something which is very common, and everybody is interested to learn sewing because that is something they can sit at home and do while they can also take care of the child and the house. So there's a general lack of supportive ecosystem which prevents women from participation in economic activities. And I think those women who have no choice but to go out, the lack of affordable childcare is definitely another aspect. Because I have seen that in rural areas, even though not perfect, Anganwadi still are able to give some kind of childcare for a few hours at least, but it becomes very kind of impossible in urban poor settlements. So therefore, we can see that many women don't go out because especially there are studies which say that if there are younger children at home, and this is across the board, not just for urban poor settlements. If there are younger children at home, there's the probability that the women would be unemployed would be higher because of that presence of the child itself. So, which is actually, I mean, I feel parenting is a equally shared responsibility, but culturally in India, it has that women are considered to be the primary caregiver. So I think that is definitely another major reason for this.
Right, and I feel like caregiving responsibilities, like you already mentioned, increased manifold during COVID. The husbands with like the entire family staying at home, they had added unpaid household work. So it must have been extremely difficult for them to even continue work, even if they had those opportunities at hand. Yeah, so if we also look at, you mentioned a stat where you said 89% of the unemployed women stated that they weren't even looking for employment. But during COVID, I'm assuming their situation would have been such that some of their husbands lost their jobs or their family income must have gone down. So did this figure change during COVID? Were more women willing to look for employment?
I think what it led to, I mean, I wouldn't say there was a shot up in demand for employment, but what it led to was definitely when we were scoping out for more centers, partners to start more centers, there were more partners coming up. There were more women coming up for that. That was definitely seen because I think it's a home-based employment that they have, and they don't have to travel. So it was easier for them to convince their families. That helped. But still, the whole question of going outside the house or outside the community is a big deterrent for women in general. What has also happened is, in fact, this has led to migration. So if the husband is not working, the whole family has kind of moved. So even in our education program, we could see that households have moved to their native places rather than giving women an opportunity to work, because even that is uncertain and not enough. The payment they get is not enough to support the whole family. I mean, a rental space in Shivaji Nagar where we work, a small rental space itself is around 5,000 rupees. So it becomes very difficult for a family to continue with just the woman getting paid. So there has been enough migration also happening because of this.
Right. So since the lockdown last year, the most affected aspect of everybody's lives in the country is the fact that the kids are not being able to go to school. And I feel like a lot of women in the urban poor settlement that you work with would be able to go to work if the kids are gone to school. And that's the hours in the day that they were free. They could do something by themselves. So how has that impacted this entire community childcare center aspect and in general the lives of the women that you work with?
Yeah, I think definitely, as we discussed earlier also, just the children staying at home has definitely increased the caregiving responsibilities of the women, and it is all the more because now all the education is kind of happening online or through WhatsApp. So there is also an increased risk of social media abuse or things like that. So there is a lot of anxiety around that. There's also a perception that all this online education is not education and it's not helping the children. So yeah, that's something which we are facing in the community. In addition, for women, definitely what we have seen in the community childcare centers is that there's a request to kind of accommodate girls up to the age of 11 or 12 at least so that the women, if they are going out for work, they at least feel safe, that their children are secure. That is something what we have seen. I think another impact specifically that I could come up with is the impact on adolescent girls themselves, because school was a venue for social interaction, a way to get out of their house environment and have increased mobility, and the lockdown has reduced that mobility and social interactions, and therefore we see higher instances of anxiety or other mental health issues in these girls. There's also an increased anxiety about how their future will look like and what will happen to their aspirations. In addition, like we discussed, that responsibilities have increased. So what we can see is that even younger, like earlier, it was around 13 years or 14 years where adolescent girls were kind of brought into taking care of their siblings or doing some or the other household work. But now with this lockdown, we can say even girls as young as 8-year-old being taken into, asked to do additional work, because the quantum of work has increased. So that's another impact, like kind of that we have seen because of the lockdown. So overall, I think mental health, increased anxiety has been there for women and adolescent girls. That's something which we can see that is happening. And there are not enough coping mechanisms in the community to address this issue.
Right. And I'm assuming that you've seen cases or at least instances where the families want the girls to drop out of education because, like you said, they believe that online education is not actual education.
Yeah, like we saw that around like 52 adolescents, not just girls, were at a risk of dropping out from school education due to various challenges. There have been increased reports of child labor and possible child marriages where we had to intervene to kind of prevent that. So this is definitely that just in a group of 200. So 52 in a group of 200 itself is a big proportion. So you can look at the larger population and see what is happening.
That makes sense. I mean, we have heard instances that cases of child marriage are going up because it's a simple, families look at it as a burden that it's a mouth less to feed for them.
Yes.
With the minimized cost of marriage, they want to get their daughters married off early.
It minimizes the cost. In addition, for boys, the child labor bit has also come in. Like we used to not see so many instances of child labor, but now we can see that. Also, another reason is that because of online education, there is a disinterest, because online education, especially in the case of low-income schools or government schools, hasn't actually led to innovations as much as we would like. It has basically led to WhatsApp-based discussions or a very ineffective ways of teaching, learning, which has reduced the interest also. So we have to constantly, in our programs, kind of motivate the children for doing group work among themselves in smaller groups at least, so that they retain that interest for learning. So that is something which is challenging. I think, I don't know about private schools, but there is a lot of scope for improvement in the way we are doing online education currently. And inclusion is another topic altogether. There's a lot to talk about, but just about how to make online education interactive, interesting, is a challenge.
Right. I mean, absolutely, I agree. I feel like there is effective online schooling throughout, kids will be motivated enough to at least stay at school and complete their education. Apart from this, which I think is a terrific recommendation, what other recommendations would you have to kind of for a blanket improvement of situation of girls and women in the country?
So frankly speaking, I think there can't be any one suggestion for that blanket improvement, because there's so much diversity in our country. There's a lot of need to contextualize. So I think one thing is to basically contextualize any policy, any project, anything that is taken on a national level needs to be contextualized to the local situation and made relevant to the community. But I think it begins from moving away from the gender binaries that we often end up in, and look at the concept of inclusiveness and equity. But specifically for girls, if I see, overall, across the years, there have been a lot of improvement in terms of status of education, policies which have come up to support increased participation of women in various fields. But I think one lacuna or one gap that continues is the need for building supportive ecosystems, which obviously needs to include the larger community or the cultural aspects of it.
Right.
For example, like moving away from the approach of protection prevention, like everything is about protecting or preventing something, to kind of a transformation. And we look at it from a lens of transformation, where we are enabling systems, working with the community and collaborating across the various group of stakeholders. If you look at any government scheme, there is a lot of scope for convergence and coming together, working with different departments. But it happens only if there is that one champion who would take it that way. Otherwise, as a system, normally even NGOs work in silos, government departments work in silos, and therefore, which either leads to duplication, which again the community responds in a different way. They get fatigued because of that, or it leads to cancellation, like they are basically against each other, going against each other on the overall picture. So I think one thing that is required is that collaborations and cooperation across stakeholders. So I can give you an example, like when we work for an education project and it is focused on learning outcomes and reducing dropouts. If we work only with schools, definitely you could see that outcome there. But at an impact level in the overall ecosystem, are you changing the behavior, the attitude of the community? We don't know. So it is important that when we look at any issue, to look at it from a lens of intersectionality and look at how we kind of build sustainable processes, which has to include the parents, the community, as well as the adolescent girls, right?
Right.
We can't work like only in schools or only in community. We have to look at that kind of building those kind of collaborations, and it may be between NGOs, between government and NGOs, between corporates and government. So all of these things, but I think that's what is required. So I can't give you a blanket improvement, but I think the approach is what we have to look at when we look at.
Absolutely, I agree. I feel like engagement on all fronts is the only thing that can improve the situation here from further on. I mean, I feel like we were making such good progress with gender equality and equity on all these fronts, but COVID has just taken us 10 steps back. Thank you so much, Malati, for taking out the time to speak to us today. I believe our listeners will find this extremely informative and enlightening. With that, we come to an end of this episode. If you want to learn more about Aknale's work, log on to aknale.org. I repeat, apnalaya.org. If you like the podcast, then please do share it with the others and subscribe to never miss an episode. Thank you for listening.